What the heck are GLP-1s, and are they good for you or not when it comes to your health? Now, you may have heard the buzzword, but you also might have heard Ozempic or Mounjaro or semaglutide or tirzepatide. If that has grabbed your attention, it's probably not uncommon these days because it's all the buzz. And there's controversy around these drugs. Today, we're going to be talking about actually the health benefits of GLP-1s. Believe it or not, there are health benefits. And talking here on the Beyond Face Value Show, I'm Laura Lewis Edwards, your co-host, here with Dr. Jill Wade, the host of this fabulous show. And I love hanging out with her because we get to talk about different interesting things.
I know.
And this one is fascinating because, everybody's on the bandwagon. A lot of people are on the bandwagon with these weight loss drugs. And the origin of these, a lot of them were just treating diabetes, type 2 diabetes and that type of thing. But you may have heard in the news these days that some people are reaping benefits from this, that there actually are benefits. And I'm going to be completely transparent here to say, you get to a certain age and metabolism slows down. Yeah, I've got a degree in nutrition. I taught exercise, all that. But you get to a point where it almost feels like you're losing the fight when it comes to weight gain and all that because of the whole thing that happens to us as we age as women with hormones and things like that, right?
Oh, amen.
Yeah.
Hello. Just look at me.
No, come on. I'm really
So true.
So here's the thing is that I was pretty frustrated about it. And I also am going to say, no one's paying us to talk about this. This is not sponsored by anybody that has anything to do with GLP-1s or Ozempic or Mounjaro, semaglutide, tirzepatide, no one. But we just think it's a really interesting topic to discuss because as of late, you'll see headlines every now and then that'll say, Ozempic has cardiovascular benefits. And you might go, well, I don't understand that because I thought my friend was losing weight with Ozempic or tirzepatide. I tried the semaglutide. It made me really, you went to a doctor, and I want to make sure if you are considering doing this, that you do go see your primary care physician, get clearance. There's some tests they might have to do to make sure that you are able to tolerate these kind of things. And I'll share with you, we'll talk a little bit about how they work and some of the benefits as well. But the tirzepatide, I had to switch over from the semaglutide, or if you're on Ozempic, that's what that really is. And it was just making me really tired, really nauseous. I was just so uncomfortable. It just was really debilitating to the quality of my life. And it wasn't really working great, and my body didn't like it very much. So I thought, before I give up, I'm going to flip over here and try this other tirzepatide, which is like Mounjaro, and it works a little differently. And it's been really amazing. I've lost 20 pounds doing this kind of thing, but I feel good. I feel great. And what I noticed about myself, I'm like, wait, and this is before I started reading about the health benefits. Wait, I don't have the achiness in my joints I had, I didn't have the inflammation. And then I go and I have blood work and there's improvements. And it's like, what does it have to do with this? And lo and behold, studies are rolling out about this. I mean, I know that we've got some things we want to talk about on the flip side of this, but what are your thoughts about this?
Well, I think you could say it with any weight loss. Okay. This obviously has its own health benefits because it's supporting the weight loss, right?
Right.
But any weight loss, and especially with these particular medications, drugs, however you want to say that, decreasing the inflammation alone, which is the core reason why we have disease. The chronic inflammation is helping this so much. And the reason why you're seeing the other health benefits, like you were talking about, as far as the reduction of diabetes, the reduction in cardiovascular disease, and a clearer thinking mind, joints that don't feel as achy, it's all based on the reduction of, ultimately, it's all based on the reduction of inflammation.
Yeah. Right, exactly. And many of us, and I know you talk a lot about inflammation. You're a cosmetic and general dentist. You have a very successful practice located outside of Dallas in Frisco, Texas. and you are wellness oriented, you are interested in the whole human being, to make it's just not about the teeth, it's not about the cavities, it's not about a smile make or just teeth whitening or whatever else. You really are interested in that. And I know when it comes to inflammation, where do you see it as a dentist first?
In the mouth, in the oral cavity. And I'll tell you, I've had the pleasure of having some patients for many, many years. Certainly after COVID, we have seen a large increase of disease coming back into our patient base. So everybody was super, super healthy right before that. And just the last couple of years have just destroyed some people's health. I've seen a ton of weight gain, the stress in general of what we went through,
About
what we're
COVID.
going through, the economical aspect of things now the election going on. Like it just, the stress of it all has really inflamed people and created situations where they had a lot of weight gain. So I'm all on board with weight loss as long as it's done, like you said, properly and healthy, in a smart way with the physician's care and things like that. I hate to see people just being able to grab this kind of medication literally off of the internet and just not really know what to do.
Right.
There's like you, like me, who have tried some of them, got very sick, did not feel well at all. And so you as a layman, you don't know how to take care of that. You don't know what's going on. So I want to highly suggest if that does happen to you to stop and talk to whoever is administering that for you so that you can kind of come up with the right solutions.
Yeah, and I'm so glad you talked about that because I was just going to mention in the headlines recently, not headlines, but in the news recently, there's been several different celebrities that ended up in the hospital and they said because of doing a GLP-1 drug. And if you read further, because if you just read the headline of that news article, you're like, oh my gosh, But what they all said was they were not being advised by a health professional. It was either self-administered or administered not by somebody that was medical. They were not doing it properly. They might be thinking more is better. I'm going to lose weight fast.
Right.
And that puts you in the hospital like that because with these kind of drugs, they start you out a small amount on purpose. You begin very small and then they increase and they find out your particular level of what's going to agree with you, if it's going to agree with you.
Right.
Because some people just can't tolerate it at all. It just causes a lot of that nausea and stomach upset and can cause other problems in the body. But then on the flip side, you've got these positive things that happen.
Absolutely.
So recently in the news, they're talking about Ozempic being great for the heart and the cardiovascular system. And it's like, well, why would that, why? What are some of the things? Because it says, also about it can lower your blood pressure, they're finding. They're finding it can improve lipid disorders or blood fat disorders like genetics. Thank you, Dad. Thank you, the Lewis side of the family. Not really, because genetically, I have some predispositions. My predispositions, in spite of having my degree in nutrition and all that, I have higher cholesterol than other people. It's just the way it is. Now, it's not been a danger. I get checked. I've even had a cardiologist that like, you're great. I've recently had one of those calcium scans to make sure I was healthy. I mean, I'm really proactive because of these sort of potholes in my road of life and my health because of my dad. But, watching triglycerides creep up and watching the VLDLs and LDLs, which are those low density lipoproteins and very low, which are the things that clog arteries. So can you imagine, I'm looking at my blood work, I'm health oriented and watching them escalate. And it's been frustrating, as well as predisposition for type 2 diabetes, also watching things creep up. And so I just got on, the semaglutide kick, then I switched to tirzepatide. And lo and behold, what do you think's happened to my cholesterol? What do you think's happened? It's gone down.
Yeah, there's some great benefits.
And there's no other
than the weight loss,
There's
right?
no other reason for it to have gone down. And so that's a really cool thing.
It is.
Also, they've been finding that GLP-1s are really great at improving fatty liver disease, which that's a big deal.
It is a big deal.
Right? And then it delays the progression of diabetes-related neuropathy. And this is just a few tidbits of how they can be good for you. But, you know, we are all genetically different, right?
Yes.
We all are biochemically unique. And what's good for even your sister or your cousin or your mother might not be good for you, right?
Absolutely.
Yeah.
And I've seen some great results. So don't anybody hear me bashing any of the meds out there right now. Just do it with caution. That's all I'm going to say. Weight loss is always good, but there's also an extreme weight loss aspect too, right? You can have somebody who really is the right weight and size and they just have dysmorphia or something like that.
Mm-hmm.
And so they try to use it to create a body style and type that really isn't healthy either by too much weight loss. So there's a little bit of everything, right?
Yeah, and there is. And, you know, and also I'm sure as a medical professional, you know, you've heard about the fact that this kind of drug, and I was going to mention how it kind of works, because it makes you not hungry.
Right.
Because it's delaying the stomach emptying, right? It also blocks glucagon secretion. It's a hormone in your body that's used to raise your blood sugar levels. It triggers insulin release from your pancreas. But one of the most important things that people need to realize is that it can eat up muscle mass. And what happens when you lose muscle mass in your weight loss? You're like, oh, I'm so happy on the scale. Look at me, I'm losing. But what happens in metabolism?
Right. It slows it down.
It slows it down, right? I mean, when you have more muscle, and that's why if you could see two people standing side by side, that one has, they're standing side by side, they weigh the same. Let's say they both weigh 140 pounds. And you look at them, and you could take a tape measure around them, and one might be much smaller who has a lot more muscle because muscle takes up less space. And then if you're heavier, you know, without as much muscle, you're going to take up more space. When you lose muscle, all those lovely calorie burning, you know, functions, like imagine a bunch of Pac-Men in there, right? They're chewing, it's your mitochondria, you know, which live in the muscle
Machine.
the energy machines. If you lose your muscle fiber, you're losing those guys that are eating up, you know, energy. So your muscles get smaller and you lose your weight, and then you try to go back to normal and you haven't eaten a lot of protein, done weight resistance to keep your muscles bigger, and then you try to go back and eat normally, and then you're like, well, I can only eat 800 calories a day or I'm going to gain weight, right?
Right.
I'm wondering how you feel about all that.
Well, the science will show how the majority of people are doing and recovering when they do decide to get off the medicine. My fear, and it's just a fear, it's just my personal fear of pharmaceutical companies that, you know, they're touting that this is a medicine for life. And I just don't know if they're touting that because of the dollar bill,
Right.
and the bottom line, or are they really being serious that they can manufacture enough of this for people? Because what I hated at the beginning when the whole rage started was that people who really needed the medicine for their diabetes literally could not get it. It was so like sold out that they, like, in a life, you know, damaging way, life expectancy way, right? I mean, like serious life death kind of situations for some people could not get their hands on it. So I hate that for the group that absolutely needs it for their diabetes. But I think time will tell and science will tell. Again, I can't really discourage weight loss in a healthy way. It's definitely part or piece of making somebody's overall health and wellness. We're going to be talking in a later episode about microbiome. And I think all of these things are so put together, right? And,
Yeah.
and what everybody needs to understand is our bodies are not individual parts and pieces. We can't only think about weight loss. We can't only think about cardiovascular disease. We can't only think about diabetes. We can't only think about liver toxicity. They all kind of function and mix together. So the one good thing that I see coming out of all of this media is that people are getting educated, people are getting more knowledge, they're understanding weight loss better, they're understanding muscle loss better.
Right.
Like all of these things are really good for the public to understand, and there's a lot of talk about it out there. So there's a lot of good education going on. So that makes me happy in general. As a dentist, though, I will tell you guys that for some of the people who do not react well, and you kind of touch base on it to the medicines, they will have a very upset stomach. They will have a lot of reflux, maybe even at times throwing up if they are eating too much or too fast, or just very uncomfortable. Well, I, as a dentist, am seeing a lot of healthy mouths who have never had cavities before on someone who's having that type of reaction for quite I'll say a long period of time, but in the general public, it's kind of a short period of time. Like I see my patients only typically about 6 months apart from each other. I will see people who have never had cavities all of a sudden begin to have cavities because the acidity that is in our stomachs needs to stay in our stomachs. It does not need to come up, and it certainly doesn't need to be in the mouth all the time. It's too acidic. And our teeth are super, super strong, but in that type of acidic environment, you can actually create cavities, some gum disease, because we were not meant to have that acidic of a mouth. So if that is you, please, please hear me, that you've got to bump up your products.
Like what?
Like your toothpaste needs more protection in it. I'm not going to get into the fluoride debate at this moment, but increase the fluoride, increase the protection level of your mouthwashes, your toothpaste. Xylitol is a huge help to try to neutralize the mouth, but we have to neutralize and try to keep that from happening, and do everything you can and talk to your physicians or whoever is, monitoring this whole process for you, and let them know that you're not feeling well, and do something about it. Don't just let it sit there and go on for months and months at a time. There's other things that can happen to you. There's other things that are not benefits or positive that you would maybe need to deal with after the fact.
Right. I mean, all you have to do is go on TikTok and type in, GLP-1s or whatever. And there's all these videos, and they really are just talking about, the good part is like they're saying bump up your protein, and they're giving, showing people going shopping and loading up on non-fat Greek yogurt, my very favorite go-to, just for a quick thing for protein, settles the stomach, decreases that acidity for me personally. But what's lacking, I believe, in a lot of these prolific, these creators that are talking about this, is they aren't talking about the negative effects of it. They're not covering that base like they should. Yeah, they're saying, well, if you're going to lose muscle, your metabolism will slow down. Okay, that'll get someone's attention, but let's talk about these other things as well, which you just mentioned. If you're asleep or during the day and your mouth is being bathed by acid, I mean, we've heard about perhaps like patients that love lemons or something, right? And they're drinking lemonade all the time, and that's a citric acid that etches away the enamel, right? So you have to think about that.
And even one step further, I'm seeing some patients who have that chronic issue with the upset stomach, and they will have an increased amount of sinus infections that are really, really hard to go away. And again, it's that acid that comes up. It doesn't just stop at the mouth. There's another hole up there that comes into the nose and then can get into the sinus cavities. Again, these are not supposed to be acidic in nature. So, great benefits. Also, have to watch out for the negative.
We kind of tricked you there. Because I did want to bring attention to that. We talked about this. There is a pro and a con. There's a pro and a con, right? Pro and a con to all of it. And you know what would be awesome if we all could just eat healthfully, work out like
Less
we
stress.
should. We had not as much stress, have great organic, wonderful foods that are nearby, and you have a great, happy, life.
Trauma.
And you lose weight when you want to lose weight. But
Absolutely.
I don't know what planet
Great
that.
hormones.
I mean,
It's in my head. It's my dreams. It's my dreams for everyone.
so anyway, I just want to say this has been a great topic to discuss. It really is the tip of the iceberg.
And I think we'll be discussing it again because as
Yeah.
time goes on and we learn more and more, we're going to be here and share that.
Yeah, we might end up finding out 5 years from now, whoops, maybe not. Maybe there's this other thing that's better, but at least we're just, promoting a bit of thought around this.
Absolutely.
And just make sure that you do check with your primary care physician. Don't go out there and get something off the internet and get yourself into the emergency room like some people have. You don't need to be doing that, but just know that there are some benefits to this if it agrees with you, that you can think about that, talk to people that are medical professionals that can guide you through the process. So yes, thanks, Dr. Jill.
Thank you for bringing this to everybody's attention.
Yes. So thank you very much. Really interesting stuff. I didn't know that about sinus infections and acid. I had no idea.
Yes, ma'am.
Wonderful. Well, that's our discussion today, all about GLP-1s, the pros and cons or the health benefits and the not so great benefits of it. We hope you've enjoyed watching the show on our YouTube channel at Stonebriar Smile Design. Go there and check out the whole playlist. We've got lots of episodes in the can, as they say, or also on your favorite podcast streaming platform. Please follow us, subscribe, like, share this with others, because the whole message that Dr. Jill and I really want to get out there is living your best life, your healthiest life, your happiest life by using some of these tips and this information that we discuss on the show called the Beyond Face Value Show. I'm Laura Lewis Edwards, your co-host with host Dr. Jill Wade. We hope you'll check us out on our other episodes, and we'll see you next time.
Also, to help us grow and expand our reach, be sure to like and subscribe to this show on YouTube or your favorite podcast platforms such as Spotify, Apple Podcasts, or whatever you prefer. Just remember, it's time to live your legacy now. I'm Dr. Jill Wade, and this has been the Beyond Face Value Show. Until next time.